A physical therapist being great when they are really in tune with the patient's needs, and it's less about that cookie cutter model. Every physical therapist that I went to, it was just a circuit. It was like I could have just gone to the gym and done the same thing, and I didn't feel like I was getting any real specialized care. And that has changed so much in the field of physical therapy when it's a high level physical therapist, which you guys are.
Many times you're working with people, there's just, people are an X factor. So you just have to be able to kind of relate to their little idiosyncratic things and nuances and be able to kind of find a way of engaging with them, especially in PT, because this is a very collaborative process. Like, we're not just doing things to the patient. It's very much we need the patient to be part of that team, to really buy in and be an active part of their solution and their recovery. It's very much, a physician heal thyself type of motto. Like, we're trying to teach the person how to fish, not fish for them.
Welcome, everybody. Thank you for being here. This is Ryan Diener with Holistic Health Associates, continuing our video series on collaborating with wellness professionals and healthcare professionals in our area. And I am super excited to be talking today to the head physical therapist and owner of Body Sense PT in Boonsboro, Maryland, where we just opened our second office. Shannon Murphy has a fantastic practice over there with multiple physical therapists. They do tons of great work. And we are going to talk today about collaboration between physical therapy, acupuncture, massage, how that all works, when, et cetera, et cetera. So Shannon, thank you so much for being here.
Well, thanks for the invite, and thanks for coming up to Boonsboro.
Oh, absolutely.
We're happy to have you.
It's been great. We love it there. We love Boonsboro. I'm there at least a couple of days a week, and just really have enjoyed being in the town. So yeah, right. And it's great to meet you. So we're excited to chat. So I think today, we're going to talk a little bit about the field of physical therapy, and just, patients always ask, like, they're so confused with when to do this and when to do that, and how you kind of, bring everything together. So let's just start first with kind of a big picture question, which is what makes a great physical therapist? What is it that makes somebody say, that's the person that I want to go to, in your opinion?
Right. Well, yeah, I think what makes a great PT is really the same thing that makes a great clinician in any field. And we can kind of step back and talk about just kind of how broad some of these fields are and how much overlap there is. But for me, it really comes down to, I think, just innate curiosity and having an open mind, and kind of having enough experience to have that pattern recognition, but still, be able to kind of individually sort through somebody's case and not just kind of default into the cookbook thing. And anytime you're working with people, there's just, people are an X factor. So you just have to be able to kind of relate to their little idiosyncratic things and nuances and be able to kind of find a way of engaging with them, especially in PT, because this is a very collaborative process. Like, we're not just doing things to the patient. It's very much we need the patient to be part of that team, to really buy in and be an active part of their solution and their recovery. It's very much, a physician heal thyself type of motto. Like, we're trying to teach the person how to fish, not fish for them.
Yeah.
Indefinitely. And so I think in general, people don't really have a strong idea of what PT is, because PT is a lot of things. But in the outpatient scope, which is kind of where you and I both work, it's a lot of your aches and pains across the body, right? If it hurts, it's clunky, it's creaky, it's probably a good candidate for PT. But there's some other aspects as far as, neurology and some specialty practices that we could dive into. But yeah, we see, we're in a community of kind of between Frederick and Hagerstown, but we're the only, PT practice in Boonsboro. So we cast a wide net. We see a lot of things.
Yeah, and it's great. And I think, the point you made about, a physical therapist being great when they are really in tune with the patient's needs, and it's less about that cookie cutter model. And that's what I loved when we talked about how you guys do physical therapy, because I was actually going to go into physical therapy, and the thing that turned me off because, and this was 25 years ago, but the thing that turned me
Right.
off from physical therapy was that every physical therapist that I went to, just, it was just a circuit. It was like I could have just gone to the gym and done the same thing, and I didn't feel like I was getting any real specialized care. And that has changed so much in the field of physical therapy when it's a high level physical therapist, which you guys are. And that's where I think there's such a difference making in being able to tailor, treatment plans to the patient. And, two different shoulder issues, but there were two shoulder issues, but you're getting two different treatment plans, or two varying treatment plans.
Yeah, absolutely. Yeah, and so the sort of the insane amount of individualism that goes into, our breed and our version of PT is very rewarding. It's not to say that it can't be a little bit exhausting, and because quite honestly, your insurance company doesn't pay us differently if we're being super, curated and like, craft beer experience versus like, the big corporate kind of mill type experience. And there's a lot of industry situations that are driving some of these patterns, but yeah, I'm glad that you've had an opportunity to kind of experience a better version of PT, because it would suck if that was was the only thing you ever experienced. But that's a lot of people, and I think that's probably a lot of people with a lot of different fields and experiences. So I think for people just to understand that, just because you've done something before, whether it's PT, chiro, acupuncture, massage, if you had a great experience, great. You've set the bar and you know what is possible. If you had a bad experience, it doesn't mean that's generalizable across
exactly
that field. Try again and do your homework and ask some questions among people that have been around the block a little bit.
Yeah, I think that's a really good point, because just because your doctor sends you to a physical therapist that they typically refer to doesn't mean that's the only person you can go to. You could go to any physical therapist. You can, you don't need a referral to go to most of the time to go to physical therapy, depending on your plan.
Right.
And it seems that things have changed quite a bit in that way, where it really is kind of like any other shopping experience, so to speak, where you want to go find the best quality, goods in the field and take advantage of that. So yeah, it's great.
Yeah, I mean, people are starting to apply more of a consumer mindset to healthcare, and I think that's, it's got its pros and its cons, but being an educated consumer of any service, I think is well recommended.
Yeah, for sure. So let's talk about collaboration for a second, because I know that you have gotten acupuncture, I've gotten physical therapy. When a patient comes to you, how do you determine when is the right time to either combine services or to refer to, to something like acupuncture, chiropractic, massage therapy? How do you go through that process?
Yeah, I mean, I think it's getting obviously getting a sense of where the patient's been, what their experiences have been. If they're really a blank slate and they've experienced, nothing, and they're just coming to PT first, and they've got a lot of stuff going on, which a lot of people do, not everyone is sort of jumping on a situation or a condition as soon as a symptom pops up, right? A lot of people are getting well into their lives and years with these things. And so we're seeing people come in with really complex backgrounds to their situations, just major digestive things, autoimmune things, lifestyle things, habit things. And, for our work to be effective, it really helps to be able to divide and conquer in some of these things. So even though we dedicate a lot more time in some practices individually, one-on-one to patient, I mean, if we're seeing you 45 minutes, one-on-one, 2 to 3 times a week, that's still a lot of hours in the week that you're left without that kind of intervention. And so the more people that we have kind of helping us unlayer these things, the better. So for acupuncture, a lot of the times that I will typically make those recommendations are, people have a lot of just systemic medical stuff going on. It just, in my experience, just having been a patient and having some insight from other acupuncturists I've known, I just feel like that's a helpful way to just start bringing the body into some homeostasis. And the more that we can get a background system that's behaving well, the more effective our work on individual nuts and bolts can be. But also some of the addiction stuff. So people are really, they need to quit smoking. They know they need to stop smoking, but they just or they can't do the Chantix, so they haven't wanted to. Like, I know that that has been an effective tool for a lot of folks. So there's just a lot of specific conditions that I kind of have tucked away in the back of my head that have been effective with acupuncture. Chiropractic, sometimes, actually, this was my husband a couple of months ago. He actually threw out his back. I just happened to be, I was at the office, I was busy. And he's a big guy. And for me to kind of deal with him when he's in acute pain and just a difficult personality to deal with at that point anyway, like, it's gonna be hard for me to be effective with him, right? Mm-hmm. So there's a chiropractor in Thormont that, he's had some good results with when he gets really acute and tweaked. And so sometimes if somebody's just bigger than I can mechanically get to sometimes, or they just have a good relationship with that person, then, if I know they're doing some of the spinal work, then I will focus more on the soft tissue work.
Yeah.
Same thing with massage. If somebody's just like got trigger points and knots for days, there's only so much we're going to be able, if that's all we ever do in PT, we're never going to get to the next level, So if I can have a massage therapist that's doing some of that work outside of PT, then I can also have a little bit more, opportunity and kind of get to those other topics in our sessions. So
yeah, that's awesome. I think that's a great synopsis. It's like, looking at where you can bring the internal medicine challenges that somebody's having into balance, and then utilize your skills with external medicine, or using somebody else's kind of focus on, structural, skeletal, so that you can focus on soft tissue, or someone else's skill on kind of a targeted soft tissue, so you can focus on strengthening. And it's like we can kind of work with each other in a way where one part of the team takes the primary role and one part of the team takes the secondary role. We've done that a lot with physical therapy, where somebody's in physical therapy 2 or 3 times a week. That would normally be, say, our recommendation for an acute problem from an acupuncture point of view. But we'll just step back and just say, hey, just come in once a week for acupuncture. And that way, right, you can kind of, you're not going to, no one can do everything. And so right, sometimes in collaboration, we have to choose to take the secondary role on purpose, so that the more important thing for that patient can be handled, in your case, through physical therapy, while we just do kind of like a little tweak on the back end from our point of view. So there's a lot right, of ways that we can do this, and it's really great to have multiple systems addressed at the same time, or kind of in succession, one for a little bit, then you go to the next one,
Right. And a lot of it just becomes a process of case management and figuring out how to sequence these things, and who's sort of taking that lead role and helping the person. We in our business and practice, I think we do take probably a little bit larger scope than some other practitioners, including some family medicine and internal medicine and just other docs, because they don't literally get the time or make the time or work in a practice where they're given the time to dig into these layers, even if we give them the benefit of the doubt that they wanted to, unless you're paying and doing the functional medicine route, or kind of going to some of these more, out of pocket type of experiences. It's not the default to expect anymore that your routine medical visit is going to try to, get to the root cause and do stuff. And we're in a very more symptomatic, reactive stage of medicine in our country. And so it just is what it is right now.
Yeah,
so
for sure. No, it makes a lot of sense. So tell us, how did you get into physical therapy? Like, why did you decide to get into this? Why do you continue to do what you do? Give us kind of your background.
My story. Well, interesting. I just literally had this back and forth thread with somebody the other day, and I was not like a lifelong physical therapist. I wasn't like a sporty kid that got hurt and went through PT. Like, that's how a lot of people kind of get that initial experience. I was all over the place. Like, I was a chemist and an astronomer when I was a kid. I was like a writer and graphics person, in high school, and I've been all over the place. So PT was not really a destined, predetermined choice, but my sister and I, grew up with a favorite aunt who was a PT. My sister was interested in PT. And so I kind of just made a shift when I was in college and kind of was moving away from more of an arts writing, computer oriented field, just recognizing that it probably wasn't going to be kind of the best lifestyle thing like long term. And just kind of chaos theory, really. I got into an experience as a helper and a student, whatever. It was just a really cool, fun practice. It was small. It was very individualized. And so I was surrounded with really good PT experiences for those first couple of introductions. And so I was like, this could work. And really that's kind of how that developed. It was not as maybe romantic as some other people's stories, but I don't think what I appreciated at the time is how practical it is. It's just so practical to have insight into your own body, into, your loved ones and that kind of stuff, but also just into the healthcare system, and just having a little bit more ability to navigate it has been just immensely useful. So I guess I'm getting older, and so it definitely has helped me with my own stuff. So that's probably as much why I continue in that realm, even though I'm not really a principal clinician anymore. I'm more, like you, kind of managing the ship, so to speak.
Mm-hmm. Yeah, no, that's totally great. I mean, I think that's it's beautiful to just be as simple as that. Like, this is really practical. This is something that many people need multiple times throughout their life. And it's just a beautiful field to be in, when you can serve people and really help them through challenging times in their life. And it's what we love about acupuncture. It's what you love about physical therapy. And it's just great to have the opportunity to collaborate with, people that are in high level of the field like you are. So I just appreciate that, and love what you guys are doing in Boonsboro. Tell everybody how they can find you. What's the easiest way to find Body Sense PT?
Yeah, I mean, physically, if you're driving by, we're right at the top of the hill by Domino's and over by Weiss. So if you're in Boonsboro, you kind of know. Online, bodysensept.com. And we're open more often than not, 7 to 7 most days, 301-432-8585.
Fantastic. Well, this has been great. I look forward to doing it again with you sometime. There's many more topics we can get into, but I just wanted to kind of give everybody a good kind of sense in this video of just like the collaborating aspect, and how multiple services can be so beneficial to your health, to your body, to your ongoing, ability to continue to do the activities that you love to do. And that's what we're here to help you with. So
yeah, well, likewise. I mean, it's always inspiring and refreshing just to kind of connect with other people outside of your own field who really get it and kind of understand, the interconnected nature of all of this. So
for sure.
My appreciation.
Same to you. All right, Shannon. Well, thank you very much. And thank you to everybody else. You all have a great day. We'll see you soon.